health justice around so many other issues as well. So that's.
Where are you at on domestic and international areas? I mean, obviously,
yeah, I mean, obviously it's something that's on my mind, right? I mean, first of all, from an LGBTQ perspective, but also my mother's from Scott County, so I've been to that needle exchange, and it was really eye-opening in terms of how rural people, low-income people in the South, I consider Southern Indiana to be the South, very much is, are also especially vulnerable. Plus South Bend, even though we're known as people think of us as a college town, we're actually a very diverse, low-income town, and we're a community with a lot of injection drug use. So I'm aware of some of those issues in addition to the things that we've been tracking kind of globally. My sense is, as you said, from a public health perspective, this is actually a lot more achievable than many of the goals we see set out from the UN. And one reason I was eager to have this meeting is to make sure, as we're chiseling what we have to say about this, we're saying things that are in line with where experts can point us in terms of what it's going to take. So, for example, an expansion of PEPFAR is clearly going to help us meet the goal. But we're working out what kind of the responsible numbers are to put out. It'd be helpful to understand kind of what it actually means to add this many more dollars into that initiative. My sense is Medicaid expansion is actually a huge part of the equation, definitely for us. Again, the only reason these people I encountered in the needle exchange were there at all, or were able to get any kind of follow-up or any kind of support had to do with Indiana's sort of kind of Medicaid expansion. It's not a kind of pure one, but they're better off than people elsewhere. So, as we think about the big picture on the future of healthcare and what we have to say about Medicare for all or Medicare for all who want it, which is what we talk about, we also have to talk about what kind of impact that's going to have. I'd be lying if I said I have the legal literacy to fully understand the IP dispute that's going on with CDC and Gilead, so that's another area where you can educate me on. I think that if I understand it right, then where the movement is going is consistent with my view that there need to be certain triggers where you reach a certain point just in terms of harm, and there's got to be a chance to talk patents and move past simply talking about purchasing things and making them available. And I'm concerned that there isn't any attention to cost in some of the legislation most recently introduced. But again, I'm very eager to be educated a little bit on some of the finer points of this because it seems to be moving pretty quickly, and I want to make sure I have a good understanding.
Well, Jason, I'm glad you mentioned you. So Jason, would love to discuss drug policy and how it relates to HIV.
Totally. So the organization I work with, Boca New York, we also operate a syringe exchange. We're doing a lot of leading work in the state around ensuring that we have supervised consumption spaces, and ultimately do a lot of work to help in the races and classes drug war that actually help fuel the overdose crisis as well as the HIV epidemic, particularly in Indiana. I went to college actually in the University of Louisville, so I'm
so you know that neighborhood.
The Kentuckiana region.
Yeah.
But one of the things I do want to say is that one of the major issues that folks in New York are experiencing, especially as we try to have overdose prevention sites or supervised consumption spaces, which have been operating all over the world for 32 years and have shown a considerable amount of success of not only just reducing the spread of HIV and hepatitis C, but also link people to critical services and support for HIV treatment and testing, as well as just keep people safe, is that we need a federal overturning of the crack house statute, right? And that's what's actually blocking us from actually being able to have these centers. Now,
so CIV is technically a crack house. A supervised injection
they're
facility
considered they're considered a crack house. So as
the current Justice Department is trying to
enforcing accordingly.
In Philadelphia, for example, the day after Trump's announcement on HIV, the Attorney General served the putative safe injection facility. It's getting started. It's called Safe House, with an enforcement order. Completely unacceptable, absolute hypocrisy.
And
wasn't there an effort in Seattle going on? Has that been interfered?
Yes, I believe there's this effort in Seattle as well as California, Pennsylvania, and New York. Those are the four that I can think of. But yeah, we're did a lot of work advocating for drug users, families, mothers who lost their children to overdose, have did a lot of work here in New York State to just ensure that we can have overdose prevention sites, and got the mayor on board and the governor on board, but we're having major roadblocks on the federal level from actually doing the work to continue to save lives. And then also we just need a lift of the federal ban on syringes, on syringes, right? We need to improve and expand access to syringes and also support the access, so we need more
You mean the ban on Medicaid funding the syringes themselves?
Yes.
Yeah. Right. And we saw that in Scott County too, right? They could provide everything but.
Yeah. So those are kind of like the two biggest issues that help not only inform, like, these are the two issues that inform the spread of HIV at the same time, causing a lot of harm in communities who are working with drug users from a place of compassion rather than a punitive place. And that's what we want